Earnings among U.S. health insurers were favorable again in 2021, but as the COVID variant showed, uncertainty related to the pandemic remains ongoing. Here to discuss AM Best's latest review and preview report on the U.S. health insurance segment are Sally Rosen, Senior Director, and Doniella Pliss, Director, both of AM Best. Sally, let's start with you. Health insurers' earnings were again positive in 2021. Now, when you consider utilization trends, deferred care, or COVID-related regulation, is there any worry that this trend can quickly reverse itself?
Yeah, there is some concern. I mean, there has been a lot of deferred care. People, both by individuals postponing care because of the pandemic, as well as when the hospital systems and the provider offices get too full, they tend to postpone some surgeries and more elective things. But there is a concern that utilization could return to pre-pandemic levels. It has improved. The level of utilization increased in 2021, but it is still not up to where it was pre-pandemic. There's also some concern about pent-up demand for things that were missed or deferred, as well as an increase in morbidity or severity of health conditions due to the deferral of care. Individuals deferred care, and while insurance companies are watching those that are higher risk, somebody's condition could have worsened. Additionally, when there, a couple of things to note, when there's an uptick in COVID cases and spread, while insurers see an increase in testing costs, this has been coinciding with a decline in non-COVID utilization. Additionally, while we are in a period of a public health emergency for COVID, which is currently through April 16th, insurers are required to cover testing at 100% of the cost, regardless of where the claim is incurred and whether it is in-network or out-of-network. If the PHE is allowed at some point during the year to expire, then insurers will see a lowering of costs for testing.
Now, enrollment jumps in Medicaid and Medicare continued. Federal government spending for health care is growing. Doniella, are there any long-term risks for insurers here?
Yes, there is always a risk of budget issues, and that can result in rate pressures for Medicare Advantage. And for Medicaid, it's also rate pressures, but also potential eligibility cuts by the states. There is a difference between Medicare and Medicaid in terms of near-term risks. Medicaid is a jointly funded program by the federal and state government. And during the public health emergency, states been receiving additional funding from the federal government towards their Medicaid cost. But in exchange for that, states are not allowed to disenroll individuals and to perform what's came to be known redeterminations. However, when the public health emergency ends, the additional funding from the federal government will expire at the end of the quarter. And after that, the states will have 12 months to perform redeterminations. It is widely expected that once all the states perform these redeterminations, Medicaid enrollment will decline significantly. Because of the period of 2 years, many individuals could have had change in circumstances and are no longer eligible for Medicaid, but they might be eligible for subsidy to buy ACA marketplace policy. On Medicare side, there are different issues. This is a federally funded program, and aging population has been putting pressure on Medicare Trust Fund and pressure on Medicare Advantage rates. The recently announced an increase for Medicare Advantage for 2023 is 8%. This is not final, but this is the highest level of rate increase for Medicare Advantage in years. It probably will be rather difficult to cut rates for Medicare Advantage because about 42% of Medicare eligible individuals are currently enrolled in Medicare Advantage plan, and this number is growing. But what carriers can see is additional attention from the government towards the data that is used for rate adjustments, especially after the Office of Inspector General published the report this past fall that the risk adjustment payments were disproportionate to certain carriers. If that happens, there can be a pressure for risk adjustment payments, which carriers came to rely on to boost their Medicare Advantage rates. But the good thing for insurance companies is that usually they know well in advance what their Medicare Advantage rates would be, and they have an opportunity to adjust products and benefits accordingly to balance profitability.
Sally, looking at trends either born of or accentuated in the pandemic, is telehealth use at the top of that list, and will the momentum continue post-pandemic?
I do think telehealth is, at the top of the list. I mean, the usage of telehealth pre-pandemic was very low. In the early stages of the pandemic, it actually grew substantially, and while it's still elevated from where it was pre-pandemic, it has come down as individuals have gone back to doctor offices. But I would, a couple of things we would note is, it has allowed insurers have, with telehealth and the increasing use of telehealth and the increasing of telehealth acceptance by both the providers and the individuals, insurers have been able to expand telehealth access to members, and some have designed benefit plans with telehealth visits as part of the plan design. It's also telehealth is seen as a positive for behavioral health. You're allowed to have a virtual visit without the stigma of somebody saying, "Where are you going?" And you're still getting the face-to-face access, but through a virtual means. And there's been a lot of increased need for behavioral health services and behavioral health visits as a result of the pandemic. The one thing we would note, though, is there's an increasing number of states that are requiring telehealth visits to be paid for at parity, and that number seems to be growing, and that is something that we continue to monitor.
Now, given the increase in ACA subsidies in 2021, Doniella, how has this impacted the supplemental health market?
Even with increased subsidies, there are still individuals who are not interested in buying a comprehensive policy, whether due to cost or because these policies just don't suit the needs of certain individuals. These individuals prefer to buy supplemental ACA exempt policy. During the pandemic, the sales of these products declined because it was difficult to have in-person meetings, and a lot of sales in this particular segment is done in person. But carriers made some adjustments, and they were able to use technologies and Zooms to have these meetings and to sell some products. On the other hand, the persistency in this segment has been above historical levels because during the pandemic, individuals were very reluctant to let go of their health coverage. From a profitability perspective, this segment continued to post good earnings in 2021. However, they were lower compared to 2020 because in 2020 they were very much affected by the COVID situation.
Looking ahead, Sally, is there anything that we haven't talked about that kind of jumps out at you as a front of mind issue, either positive or negative?
Sure. Yeah. I mean, overall, the industry has performed well. The industry has remained profitable overall, and earnings declined in 2021, but that was to be expected, especially given the impact in 2020 from the widespread deferral of care. Majority of insurers have accumulated strong levels of risk-adjusted capital, which enable them to handle any of the challenges that may lie ahead. We would note, though, that the substantial rise in testing in late fourth quarter and into early January 2022 was not expected by the health insurance companies and was not included in 2022 pricing. If the level of testing were to persist or reoccur, it could ultimately pressure earnings. However, the Omicron wave appears to be declining, with the number of tests and cases seeing a significant decline at this point throughout the country. The one thing we would note is that smaller and or regional health insurers, especially in areas with low vaccination rates, have had some pressure from COVID, as some of these companies saw a rise in testing and COVID-related claims in the third quarter from the Delta wave and again in the fourth quarter from the Omicron wave. These companies, many of whom do not have strong risk-adjusted capitalization or parents with the financial wherewithal to provide financial support, could continue to face pressure from COVID.
That was Senior Director Sally Rosen and Director Doniella Pliss. And I'm John Weber for AM Best TV.